The COVID-19 pandemic brought unprecedented challenges to healthcare systems worldwide. Nurses, being at the forefront of patient care, faced a dramatically altered reality. Nurse Maria states,
"One of the most significant changes was the need for stringent infection control measures. Hospitals implemented rigorous protocols, emphasizing the use of personal protective equipment. Nurses donned gowns, gloves, masks, and face shields, creating a barrier between themselves and the virus. Cleaning and disinfection procedures were heightened, with meticulous attention to high-touch surfaces. This new emphasis on infection control became second nature to us, demonstrating our commitment to patient and personal safety." The pandemic also accelerated the adoption of telehealth services. With hospitals overwhelmed and in-person visits limited, remote monitoring became crucial.
Nurse John also mentions,
We quickly adapted to using technology to monitor patients remotely, providing virtual consultations and educating patients on self-care at home. This rapid expansion of telehealth highlighted the adaptability of nurses and the versatility of their skills. It also underscored the importance of technology in ensuring continuity of care, even amidst a global health crisis.
the COVID-19 pandemic presented a steep learning curve for healthcare professionals. New treatment protocols emerged rapidly, often with limited scientific evidence. Nurse Sophie states,
"We found ourselves on the front lines, implementing these evolving guidelines and adapting to new medications and therapies. The virus was unlike anything we had encountered before, requiring constant learning and adaptation. Nurses attended countless webinars, studied research articles, and shared best practices with colleagues. This dedication to staying informed ensured they could provide the most up-to-date care for their patients."
Nurse Sophie also stated,
Beyond the medical aspects, we also had to navigate the emotional and logistical challenges of a constantly shifting landscape. We grappled with shortages of essential equipment, rapidly changing hospital policies, and the fear and uncertainty surrounding this novel virus. Yet they persevered, drawing on their training, experience, and unwavering commitment to their patients' well-being. This ability to adapt and learn quickly became a hallmark of nursing practice during the pandemic. It highlighted their resilience, problem-solving skills, and unwavering dedication to providing the best possible care, even in the face of unprecedented challenges.
While nurses are known for their strength and resilience, the COVID-19 pandemic took a significant toll on their mental health. They faced long hours, staffing shortages, and the constant fear of contracting the virus themselves or transmitting it to their loved ones. Nurse Aisha states,
The emotional burden of caring for critically ill patients, many of whom did not survive, was profound. Recognizing these challenges, hospitals and healthcare organizations implemented various support systems. Counseling services were made available, offering nurses a confidential space to process their experiences and develop coping mechanisms.
Nurse Aisha also mentioned,
Peer support groups emerged, providing a platform for us to connect and share our struggles with colleagues who understood our unique challenges. Hospitals also focused on creating a more supportive work environment. Managers encouraged open communication, provided regular breaks, and recognized the extraordinary efforts of their nursing staff.
Nurse Aisha went on to further state,
These initiatives, while essential, only scratched the surface of addressing the profound emotional toll the pandemic had taken. The need for ongoing mental health support for nurses remains paramount, even as the acute phase of the pandemic subsides. Investing in these resources is crucial to ensure the well-being of these dedicated professionals who have given so much during these unprecedented times.
even in the midst of a global pandemic, the essence of nursing, patient-centered care, remained steadfast. Nurses went above and beyond to ensure that their patients received compassionate, personalized care. Nurse James states,
"We knew that our patients needed more than just medical treatment. They needed to feel heard, understood, and connected, especially when their families couldn't be with them. Nurses facilitated communication between patients and their families through video calls, ensuring that the human connection was not lost."
Nurse James goes on to further state,
"It was about preserving humanity in healthcare. We held hands, offered words of comfort, and provided a sense of normalcy in an otherwise chaotic environment. This unwavering dedication to patient-centered care amidst a pandemic highlighted the true spirit of nursing, It showcased their ability to adapt, empathize, and provide holistic care, even in the most challenging circumstances.
Nurse James states,
Our commitment to our patients' well-being, both physically and emotionally, is what defines us as nurses. And this pandemic, if anything, has only strengthened that commitment. As we move forward, the lessons learned and the resilience demonstrated by nurses during this time will continue to shape the future of healthcare.